Hello and welcome to our webinar. We will be presenting some of the findings of the 2019 Canadian Trans and Non-Binary Youth Health Survey. Before we start the presentation, I would like to acknowledge that the land where I live and work is on the unceded ancestral territory of the Coast Salish people and also includes the territories of the Musqueam, Squamish, Tsleil-Waututh, and Stolo nations. My name is Ashley, and I'd like to make sure and mention the rest of the team who helped create this presentation. The PI of our study, Elizabeth, as well as Ace and Julie. The general topics of our presentation are listed on this slide. And as you can see, we're going to begin with an introduction to our survey, including the methods we used. Most population-based youth health surveys do not include trans or non-binary youth yet. There are a few reasons for this, including the sample size of trans non-binary youth being too small to analyze separately, not enough space in surveys to add trans-specific questions, and the unknown factor of youth safety. Are youth responding to the survey in a hostile home or school environment, for example? Our online survey in both French and English included 147 questions asking youth about various health, risk, and protective factors for youth age 14 to 25. The survey collected responses from November 2018 to May 2019. Our survey is a repeat of the 2014 CTYHS using the same methods, including several gender identity questions. Our research team includes researchers from 8 Canadian universities and 1 university in New Zealand. In addition, our research team includes Francophone and Anglophone, trans and cis, as well as graduate and undergraduate RAs and postdocs. Members of our research team also created trans and non-binary youth advisory groups in Alberta, BC, Ontario, Quebec, the Atlantic provinces, and an online rural group. Moving on to some of the demographics of the youth in the survey. In total, 1,519 youth participated from every province and territory in Canada. In this graphic, you can see the breakdown of youth in each province and territory. %10 of youth completed the survey in French, 12% of youth identified as Indigenous, and the mean age of youth in the survey is 19.9 years old. Additionally, 91% of youth told us they were born in Canada. This is one of the gender identity questions we asked youth. We asked, which one response best describes you? I am transgender and identify as a boy or man. I am transgender and identify as a girl or woman. I am transgender and identify in some other way, or I am not transgender. I would like to mention that the 7% of youth who reported not being trans did indicate a non-binary identity in either one of our write-in questions or one of our other gender identity questions. Here's another gender identity question we asked. What is your gender identity? Mark any that apply. And you can see we had various options to select from. The most common response was non-binary. On this slide, you can see some of the write-in comments that we received about our gender identity questions, detailing some of the difficulties youth face when being asked about their gender identity. Even though I still strongly identify as a trans man, there is a piece of me that sometimes leans a little less man and it's complicated. When talking to cis people, I describe my gender as not a man, not a woman, but a third option without limits. We asked youth if they were currently living in their felt gender, and 50% of youth said they are living in their felt gender full time, 36% part time, and 14% were not living in their felt gender. 30% of youth have changed their name to reflect their gender identity, while 78% of youth would like to change their name. We asked youth if they had the correct gender listed on several identification documents, including their birth certificate, healthcare card, driver's license, school records, student ID, foreign passport, medical records, and Canadian passport. The document most likely to have youth's correct gender listed is a birth certificate, while the document least likely to have the correct gender listed is a foreign passport. The majority of youth said the wrong gender is listed on all of their IDs. Youth who indicated that their wrong gender was listed on one or more IDs were asked about the reasons why the wrong gender was listed. 58% plan to but have not tried to change their gender details yet. 39% are worried that changing their gender would put them at risk of harm or discrimination. 37% said the gender options that are available, male or female, do not fit my gender. 38% cannot afford it. 33% do not know how to do this.
All right, this is Ace, and I'll be speaking about healthcare access for trans and non-binary youth in Canada. This graph shows respondents who answered yes to the questions regarding where they access care. We can see from the graph that a larger proportion of trans and non-binary youth access healthcare through their nurse practitioner or family doctor than a walk-in clinic. For youth who have a nurse practitioner or family doctor, 64% reported that their care provider knew their gender identity, while 29% said that their care provider did not know about their gender identity. When trans and non-binary youth were asked about their comfort with their healthcare provider, a majority of youth reported that they were uncomfortable to very uncomfortable with their healthcare providers at walk-in clinics. We can see from the graph that a large proportion of youth were comfortable to very comfortable with their regular primary care provider. When trans and non-binary youth were asked if they missed out on needed mental health care in the past 12 months, 70% of them said yes. The top 3 reasons for delaying access to mental health services were that they thought or hoped the problem would go away, they were afraid of what the doctor would say or do, or they had a negative experience or experiences before. When youth were asked if they had taken hormones to affirm their gender, 44% said yes. When youth were asked about the reasons for not accessing hormones, a majority of youth said that they were still deciding if taking hormones was right for them. For those who responded other, they had an option of telling us what these other reasons were. A 20-year-old from Ontario said, "My mother is not fully supportive, so I will pursue hormones once I leave the house, though I know that I will struggle finding a doctor to prescribe them to me." A 17-year-old from Saskatchewan said, "I would need to travel out of my city to get prescribed, and my parents don't want me going on hormones." And a 22-year-old from Alberta said, "Waiting to see a doctor because I'm too scared to go ask a random practitioner if they'll start the process, So I've sought out a doctor who has a good history with trans people, and they unfortunately have a long wait time. I'm now going to be giving some highlights on data related to gender-affirming surgeries. For trans and non-binary people who had completed their readiness assessment for surgery, 41% of youth said that getting this referral was difficult. For those who had the readiness assessment for surgery, this map shows the location of where those assessments occurred. We can see that a majority of youth who took the survey reported having their assessments in BC. Among those who completed the readiness assessment for surgery, 27% of youth reported that they were informed right away at their appointment whether or not they were approved for surgery, while 19% of youth reported that they were still waiting to hear back. For those who completed the readiness assessment for surgery, 95% of youth reported that they had accessed chest surgery, and 30% reported that they accessed vaginoplasty. Please note that phalloplasty, metoidioplasty, clitoral release, and voice feminization were not on this graph, as they had responses that were less than 10%. Among those who completed the readiness assessment for surgery, youth were asked what types of gender-affirming surgery they wanted. We can see that 60% responded wanting a hysterectomy, 58% wanted chest surgery, and 46% wanted vaginoplasty. So there are some implications from the data that was presented. We can see that we need more education for healthcare providers so that trans and non-binary youth can feel comfortable accessing walk-in clinics and mental health services. There also needs to be more support for youth who want access to hormones, but can't get them due to travel limitations, lack of family support, or wait times to see a healthcare provider. And lastly, there needs to be an increase in access to gender-affirming surgeries.
Hi everyone, my name is Julie Temple. My pronouns are she and her, and I'm from Memorial University. I'm in St. John's on the island of Newfoundland, territories of the Mi'kmaq and the Beothuk. I'm going to present to you today our results that deal with family and social support. So we asked young people about their support system. We asked the top 3 groups that they asked for help in the past year, the past 12 months, who they found helpful. So 88% found a friend helpful, 77% found a mental health counselor helpful, and 76% found a youth worker helpful. We also asked young people to name those people or groups who they had sought help from, but who were actually the least helpful. So almost half, 49%, named a telephone helpline as the least helpful, 35% a family member, and 33% a friend's parent. We also asked young people about the types of support that they had available to them most of the time. We gave them a checklist of these types of support. And between 1 in 3 and 1 in 5 young people said that they had these types of support available to them most of the time. Of course, this is a concern because it means that the majority of trans and non-binary youth who completed our survey did not have these supports available to them most of the time. So we asked someone to get together with for relaxation, but 26% had this type of support available. Someone to do things with to help you get your mind off things, 29%. Someone to help you if you are confined to bed, and someone to prepare your meals if you're unable to do it yourself. About 1 in 4 youth had this type of support available to them. About a third had someone to confide in or talk to about yourself or your problems, and also someone to give you advice about a crisis. 1 in 5 felt they had someone who understands their problems and someone to help with daily chores if they were sick. And also 1 in 5 said they had someone who hugs them available most of the time. And then 1 in 4 said that they had someone available to them whose advice they really want. We also asked youth about parent relationships. And here, because we saw that most youth had cisgender, heterosexual parents and could name a mother and a father in their lives, we wanted to explore the gender differences between the support that they had from those parents, because we've seen in the literature that there can be quite a gap between. So of course, this does leave out young people who don't have heterosexual parents, young people who are in the foster system, who have caregivers who are not a mother and father, who have non-binary parents. It leaves out all of those. But we did focus some of the questions on asking young people if they named a father and a mother in their lives to compare those relationships. And so we found that 27% of youth felt close to a mother, and only 13% felt close to a father. Similarly, 34% said that they had a mother in their life. The mother was warm and loving towards them, whereas only 20% said that a father in their life was warm and loving towards them. Comparing again for young people who had a mother and father in their lives, we asked them to rate how much their parents care on a scale of 1 to 5. And once again, the average for mother is 4.1, significantly higher than 3.6 for the father in their lives. In terms of satisfaction with parent relationships, we also saw quite a gender gap. And so we saw 23% strongly agreed that they were satisfied with the relationship with a mom in their life, whereas only 14% strongly agreed that they were satisfied with a relationship with a dad in their life. And 17% strongly disagreed that they were satisfied with a relationship with a mom, while 22% strongly disagreed that they were satisfied with a relationship with a dad. We know that pronouns and being called by the correct pronouns is very important for the health and well-being of trans youth. And so we asked about the people in young people's lives who they had asked to call them by their own name and pronoun. And so 92% had asked trans friends to call them by a different name or pronoun. 86% had asked cisgender friends. 85% had asked parents to call them by a different name or pronoun. And then 71% had asked siblings or roommates to call them by a different name or pronoun. We also asked young people if they planned to ask other people to ask them by a different name or pronoun. So 19% had asked extended family, 16% had asked their child or children, 15% had asked their coworkers, and then this is planning to ask these people. So 15% were planning to ask their coworkers, and then 14% were planning to ask siblings or their cultural community to call them by a different name or pronoun. And finally, representation is so important and is something that we're seeing change in the media. Representation of trans, two-spirit, non-binary, and gender diverse people, and seeing more people in the community. So we wanted to ask trans and non-binary youth if there are trans or non-binary people who they really want to be like, and if there are trans or non-binary people who they admire or look up to. So 64%, almost 2/3, said that there are trans or non-binary people who they really want to be like. And 77% said there are trans or non-binary people who they admire or look up to. That's it for me. Thanks so much for joining us.
Now we will pivot to our findings on discrimination and violence. We asked trans and non-binary youth if they ever avoided situations because of a fear of being harassed, being read as trans, or being outed. The majority of youth felt unsafe in all areas listed, including school washrooms, public washrooms, gyms or pools, school locker rooms, and malls or clothing stores. Public washrooms were avoided the most. This pie chart represents the percentage of youth who have ever experienced physical dating violence. 27% of youth have experienced dating violence. We define dating violence as having been hurt physically by a date or someone you were going out with, including being hurt by being shoved, slapped, hit, kicked, or forced into any sexual activity. Youth reported in the past year having experienced discrimination or being treated unfairly by others in Canada because of age, sex, physical appearance, and sexual orientation. The highest category being sexual orientation. This bar chart details how many times in the past year youth experienced being bullied, taunted, or ridiculed. It is worth noting that only 24% of youth reported never being bullied. Youth were asked how many times in the past year another person touched, grabbed, pinched, or brushed against them in a sexual way which they did not want. The number you see, 28%, is the percent of youth who reported ever being forced to have sexual intercourse when they did not want to. This chart examines the relationship between sexual abuse and running away from home. Youth who reported never running away from home were less likely to have experienced sexual abuse than youth who reported ever running away from home. Among youth who never ran away from home, 43% reported sexual abuse. Among youth who have ever run away from home, 60% reported experiencing sexual abuse. This bar chart indicates how often youth were made to feel unsafe on the internet in the past year. 39% of youth have experienced feeling unsafe on the internet in the past year. In the past year, 79% of youth reported someone said something bad about their sexual orientation or gender identity. Additionally, as we can infer from write-in comments and existing research, youth are experiencing harassment based on gender expression as well. Next, I would like to present one specific finding about mental health. We asked youth if they have had suicidal thoughts in the past year, and 64% said yes, while 21% of youth reported a suicide attempt in the past year. Even one attempt is too many, and hopefully with increased supports and protections, we can work towards reducing suicidality of trans and non-binary youth. This slide lists our entire CTYHS research team, as well as some of the community organizations we partnered with. Thank you all. Our research is funded by CIHR. And now for the live Q&A. Hello, everyone. Ashley here. All right. Let's see.
Hello, and I'm Stephanie. Sorry, I can help. I can help just read out some questions here. We've got some in the Q&A tab. So Sebastian is asking, were any of these descriptives, example, comfort with doctor, accessing hormones, etc., adjusted via waiting to correct for underrepresentation of some groups?
That's a great question, Sebastian. Hi. No, we did not adjust or have any weighting on our frequencies or descriptives that you saw in the presentation. However, we probably will be doing some weighting, if I had to guess, for some of our publications moving forward.
Okay. And Sebastian is also asking, I'm wondering how the data about parental relationships compares to prior studies using these questions or measures with cisgender youth.
That's a good question, Sebastian. We have not compared our findings to any other studies thus far. That might be something we do looking ahead.
Okay. And Gilbert is asking, did you break down stats by province so far?
Yes, we did. We have run all of the analyses by province, and we have provincial fact sheets that are actually attached to the end of our national report in both French and English. And maybe we can link the webpage so that they can pull up.
For sure. Yes, I'll grab that and put that in the chat.
Awesome.
Gabrielle is asking, how do results differ between trans binary and trans non-binary youth?
We did not differentiate any of our analyses breaking down just by between trans binary and trans non-binary youth. That is a good question.
Okay. Andras is asking, I wonder if the webinar will be available to watch later, and the answer is yes. We're going to upload that to YouTube, and we'll send it around in an email to all participants as well.
Hi, Andras.
Hi. And Eli is asking for the variables looking at barriers to care, such as wait times for readiness assessments or comfort with doctors. Were these significantly related to at all to rurality or other covariates?
Mm-hmm. Yeah, so we did actually look at a few analyses looking at urban versus rural youth, and we actually didn't find many significant differences. But moving forward, this may be a paper we actually publish on some of the differences that we found, but I can't remember them off the top of my head.
And so Andres is also asking, could respondents indicate if they had an intersex variation? If yes, what was their proportion within the sample?
That's a good question, Andros. Yes, we did ask, and I do not know the percent off the top of my head, but that is something that I can provide the exact percentage for when we post the presentation to YouTube. We can post it as a comment.
And Gabrielle is asking, as far as you can tell, how do Canadian results compare to results available in other countries, though few comparative results?
That's a really good question, Gabriel. We have not compared our results to results of other countries. However, in theory, there are some less barriers compared to, say, some states in the US. So maybe being less barriers in access to care and gender-affirming surgeries. There could be differences, and that might be something we look at in future analyses. It'd be really interesting to see if there are differences by country.
Okay. So it looks like all the questions that we have there in the tab. Let me just check the chat. Okay, Eli is also asking another question. So he says, I'm heartened by the percentage who were never bullied. I have a similar question as my previous one in terms of whether you found any factors that were associated with frequency of bullying victimization.
Good question, Eli. No, we have not done any further analyses surrounding bullying, but that is something we will be looking at. And I think some of our co-investigators are also very interested in looking at some protective and risk factors for bullying.
Genevieve is asking any significant differences in 2019 compared to the last BSBM survey conducted. I'm not sure, I'm not familiar with the BSBM survey. Are you, Ashley?
I'm not familiar either, I apologize.
Genevieve, did you want to, oh, being safe, being me.
Oh,
we call it CTYHS, which, but I understand the being safe, being me now, yeah.
Yeah, that's a good question. And yes, we do have some significant differences. For example, more youth are living in their felt gender now than in 2014, and more youth are able to access primary care physician and hormones than in 2014. Those are just a few.
Great. So Jerry Lynn is asking, this may be a philosophical question, is non-binary a transitional state, or do those who identify that way feel they will stay that way?
Good question. And yes, perhaps a philosophical one. I would say that a person who identifies as non-binary, they get to decide what their identity is. So if they identify as non-binary, then if they at some point in life decide that they would like to change that identity, that is also fine. Or they could stay non-binary. It's up to a person to decide what their identity is.
So Jerica is asking, I know you reported 44% have taken hormones for gender affirmation. Did you ask what percentage of youth desire to be on hormones total, including those who are not on hormones for access issues?
We did not. We only asked the follow-up question of the youth who answered the question saying that they were not currently taking hormones.
Okay. So let me just check the chat again. That's everything that's in the Q&A tab. And so just a reminder that I did end up putting up that link to our website, the CTYHS. So it's saravic.ubc.ca/CTYHS 2019. And up there we have information about the report and everything, all the knowledge translation we did for that, as well as some videos that we've just launched yesterday. So you can have a look at those. And if there aren't any more questions, we might pop out, and thank you so much for coming.
Thanks, everyone.